Welcome to our education session about dietary measures that can help improve your blood pressure control and keep you healthy in the setting of chronic kidney disease. This is Dr. Kadri, and I will be narrating this session for you. Paying close attention to certain dietary measures can have a significant impact on your degree of blood pressure control and help you to avoid complications from having chronic kidney disease. It is important to note that the following presentation is meant to provide you with simple guidelines to help you control the amount of sodium, potassium, phosphorus, and fluid in your diet when this is deemed necessary by your healthcare practitioner. These guidelines can vary among individuals based on their specific lab work. Individual recommendations may not apply to everyone, so if you have any questions, please feel free to check with your doctor. If you have high blood pressure or early chronic kidney disease, one of the most important things we ask patients to do is to restrict sodium or salt in their diet. This can significantly help to improve your blood pressure control and also reduce your likelihood of developing swelling in your ankles. It is important to note that avoiding the salt shaker is only part of avoiding sodium in your diet. Most of the sodium that you take in on a daily basis is already present in the foods that you eat, so it is extremely important to know the salt content of all foods that you take in. Sodium is an extremely important mineral in your body, and it is necessary for controlling your fluid balance as well as your blood pressure. Excess sodium in your body can lead to swelling. This is often found first in your lower extremities. Excess total body sodium can contribute to worsening blood pressure control as well. We often take too much sodium in the form of table salt, sea salt, preservatives, and certain seasonings as well as processed foods. It is really important to read labels in the food that you eat and to count the total number of milligrams of sodium in your diet on a daily basis. Avoiding table salt is only part of the equation. In general, we ask most patients to limit their sodium intake to under 2,000 milligrams per day. It is important to also be careful with salt substitutes in case you are also asked to be on a low potassium diet, because many of them substitute the sodium with potassium. Potassium also plays a vital role in our bodies. It is important for proper nerve and muscle function. Generally speaking, patients will only be asked to avoid potassium if they have fairly advanced chronic kidney disease. You can also get a low potassium if you are on certain medications like diuretics or if your nutritional status is very poor. Hyperkalemia is what we refer to when someone has a high potassium level. As mentioned, high potassium levels generally only occur in the setting of advanced chronic kidney disease, but can also occur if you have severe dehydration and are taking in a lot of potassium in your diet. At times, certain medications that you may be on may also increase your risk of developing a high potassium, but this generally only occurs if you have significant kidney disease. If your potassium elevation is mild, it usually does not cause any serious concerns. Severe hyperkalemia or high potassium levels, however, can cause heart rhythm changes and even sudden cardiac arrest. The treatment for high potassium centers around avoiding foods that are high in potassium content, such as bananas, oranges, tomatoes, potatoes, and chocolate. Certain alternatives would include berries, apples, grapes, pineapples, watermelon, cucumbers, peppers, and peas. Of course, these should all be in moderation. One of the most important ways to keep your potassium under control is by increasing your water intake as long as you don't have any increase in swelling or shortness of breath. The more water you take in and the more urine you make, the more potassium you will flush out of your body. Your healthcare provider may request a repeat lab assessment to ensure that your potassium has improved with these measures. Your medications may be reviewed and altered in some cases. If your potassium level is extremely elevated, you may be asked to go to your nearest emergency room for urgent treatment. A low potassium is referred to as hypokalemia. Common causes of hypokalemia include vomiting or diarrhea, certain medications such as diuretics or water pills can also drop your potassium level. Poor nutritional intake can also lead to a low potassium. A mildly depressed potassium level usually does not cause any significant concerns. If your potassium is severely depressed, it can cause serious heart rhythm changes and muscle weakness. The treatment of a low potassium often involves increasing potassium-rich foods in your diet, such as bananas, tomatoes, oranges, chocolate, and potatoes. A potassium supplement may occasionally be prescribed on a short-term or long-term basis. Repeat lab work is often necessary to ensure your potassium is within normal range after intervention. If your potassium is extremely low, you may be instructed to go to the nearest emergency room for more urgent treatment. Phosphorus is also an essential mineral in your body. It is found in most of the food we eat. It is absorbed in the stomach and small intestine and later stored in bones. There exists an important balance between calcium and phosphorus, crucial to prevent bone disease. A high phosphorus level in the blood is referred to as hyperphosphatemia, and a low phosphorus level is referred to as hypophosphatemia. Hyperphosphatemia generally only occurs if you have advanced chronic kidney disease. As mentioned, high phosphorus in your blood generally only occurs if you have advanced chronic kidney disease. If your kidney impairment is mild, this generally would not occur. If you do have hyperphosphatemia, taking in a diet high in phosphorus-containing foods will only worsen this problem. If phosphorus levels are high, hormonal changes can occur in the body that can lead to progressive bone loss and put you at increased risk of fracture over time. High phosphorus levels can also cause severe skin itching, and in a very worst case scenario, calcium can deposit with the phosphorus in arteries and skin tissue and lead to heart disease and skin ulceration. The treatment of a high phosphorus level usually consists of reducing the phosphorus content in your diet, avoiding foods such as dark colas, beer, dairy products such as milk and cheese, dried fruits, bran and granolas, and whole wheat products. If needed, a phosphorus binder may be added, such as calcium carbonate or Tums Ultra, taken at the beginning of each meal to reduce the phosphorus absorbed from your diet. Some simple rules when you have a high phosphorus level would be to avoid the following: dairy products such as milk and cheese, nuts, seeds, and peanut butter, dried beans and peas, bran and whole grain products, as well as chocolate and dark colas. Some better alternatives that are low in phosphorus content include fresh fruits such as apples, blackberries, grapes, and tangerines, fresh vegetables such as cauliflower, carrots, cucumber, and celery, popcorn, crackers, and rice cereals would be good alternatives, and drinking coffee or tea without milk, and if you enjoy cola, concentrating on light colored sodas such as ginger ale. Maintaining proper hydration levels and fluid balance is very important if you have kidney or heart disease. Maintaining the proper balance of fluids and electrolytes in your body helps to optimize muscle function as well as the chemistry in your bloodstream. The amount of water that you take in on a daily basis can affect the level of electrolytes in your body. Hypervolemia refers to having excess fluid and often salt in your body, which can lead to swelling or increasing shortness of breath, particularly if you have chronic kidney disease or heart failure. Hypovolemia refers to dehydration or not enough fluid in your body. This can reduce your kidney function as the kidneys need fluid to operate most effectively. Too much fluid in your body can accumulate if you have very advanced chronic kidney disease or significant congestive heart failure. This is referred to as hypervolemia or fluid overload. As mentioned, hypervolemia can occur if you have advanced chronic kidney disease or congestive heart failure. It can also occur if you have significant liver disease or severe malnutrition with low protein levels in your blood. If hypervolemia or fluid overload is severe, it can lead to fluid building up in your lungs, causing shortness of breath, or in your extremities, causing significant edema and heart failure. If you have fluid overload, this can cause shortness of breath, swelling under the eyes, hands, or most usually in the ankles and feet. It can also lead to high blood pressure or worsening blood pressure control. The treatment for fluid overload often consists of reducing your total fluid intake, increasing or adding diuretics or water pills, and if severe enough in the setting of very advanced chronic kidney disease, hemodialysis may be needed to remove excess fluid. Hypovolemia refers to dehydration or a lack of enough total fluid in your body. This can affect your kidney function and electrolytes. Hypovolemia or dehydration can be caused by significant vomiting or diarrhea, often in the setting of a flu-like illness, poor oral intake of fluids, and at times, overuse of medications, especially diuretics. The concerns with significant hypovolemia or dehydration are that it can lead to worsening kidney function or acute kidney injury, as well as electrolyte imbalances, particularly with your potassium levels, that can subsequently lead to heart rhythm disturbances. If you are significantly dehydrated, this can often be assessed by your healthcare practitioner by examining the characteristics of your skin. A dry mouth, dizziness, and low blood pressure can be symptoms and signs of dehydration. The treatment for significant dehydration involves increasing your fluid intake, and often a medication review is necessary with a reduction of diuretics as needed. If severe enough, an emergency room visit may be needed for IV fluid therapy and to determine the exact cause of severe dehydration. This program has been supported by the Care for Kidneys Foundation.